What is the most incredible impact that you've seen peptides create in a patient?
So one of the most frustrating things about my practice is treating infertility in young men that have significant metabolic dysfunction. These are young men that have a low sperm count, right? So they can't get pregnant because they just don't have the numbers to make it happen. And you're looking at them and they're morbidly obese, okay? They have high insulin resistance, all right, and their endocrine system has been damaged by that obesity. So they don't have low testosterone levels, and their brain is not making enough of the signals to stimulate their testicles. Now, we have medications that we can use to help stimulate that, to make more of that signal to stimulate the testicles, right? But really what is eating at them, what is causing this is not that chemical imbalance. That's the symptom. It's not the problem, okay? And treating symptoms doesn't really get you very far. And so I would have patients that I would take care of and we would never see a significant improvement in their numbers because losing weight is really, really hard, regardless of all of the education and resources I try to give them. But now we have peptides in the form of GLP-1 drugs like semaglutide and terzepatide. And I just saw a patient last week who increased his sperm count 10 times over and is now in a normal range because he's lost 100 pounds due to using terzepatide, exercising, and improving his diet. And he has totally changed his life.
And that started with a peptide?
It started with a peptide.
We will go into them individually, but just can you give me a high-level view of the types of areas in our health and life that these peptides can help with? So we've talked there about infertility.
Correct.
As a downstream consequence of the weight loss and fixing the metabolic health. What other parts of the body do peptides touch?
The best way to think about it is like this. So peptides are almost like an app on your phone. So imagine before we had apps. Like I'm old enough to remember trying to log on and do my banking online before we had apps. And gosh, it was so painful, right? Like there were ways to accomplish things, but they were very inconvenient in a roundabout way. And now all of a sudden we have these apps on our phone that can do just about anything except fold your laundry, right? There's some limits to it, but I mean, really the sky's the limit from an electronic standpoint. And really that's what peptides are. So the thing is that we have peptides that can help you lose weight, like the GLP-1 drugs. We have peptides that can improve skin quality, like GHKCU. We have peptides that can help heal your gut, like BPC 157, particularly effective in ulcerative colitis, which is something that's being investigated with the FDA's planned upcoming meeting on it. We also have peptides that can help with sleep and with recovering the gland in your brain that's responsible for melatonin and regulating your sleep-wake cycles. So the question isn't, what can peptides do? It's kind of, well, what can't they do? And if they can't do that yet, can we develop a peptide that can accomplish that task?